start the proceeding, I just give a small thing that we are going to talk about pandemic, a failure of global health security, and the speaker is Group Captain Dr. Rajiv Patni. The program shall be held, the talk shall be held for 40 minutes, and there will be a question answer session for about 15 minutes. In this, we will also have some comments from the people who want to say some comment. If there is a question, you can put in the chat box, and I will at the opportune time put that question to the speaker. And towards the end, if somebody wants to speak, he or she can write the name in the chat box that I want to speak for a brief moment. So I will put that person through also. My back office is going to coordinate this program. Before we start, I will pass on to our President, Dr. Yashpal Sharma, for a brief on today's program. Over to you, sir.
Thank you, Dr. Ashish. It's a great day today that we are organizing 8th webinar. And I'm really thankful to all of you, especially the senior stalwarts, members of EHA, students, healthcare professionals, for giving valuable time for this webinar. And I welcome Dr. Rajiv Patni. For today's talk, we are going to talk about the pandemic, a failure of global health security system, whether it has been a failure or we have, been able to do well and respond in an appropriate time. We will be talking about this. And in the beginning itself, I'll request the AHA members to kindly subscribe our AHA YouTube channel, because all the programs are being recorded, and these recorded programs, if you subscribe the YouTube channel, you will be able to get into it, and you can have even the recordings of the other programs held earlier. I will also request you to please visit our social media pages. We are very active on the social media pages, and through this medium only, I'll request our senior colleagues, especially Dr. Siddharth Satpathy and other people who are from the hospital administration department, to please ask the students to send some articles for JAHA, and also enroll themselves as members of EHA. Without taking your much of time, I will, set the ball rolling by saying few, talking about say some points before the Dr. Patni takes it over. As you know, that global health security is the existence of strong, resilient public health system that can prevent, detect, and respond to infectious diseases threats wherever they occur. And you are aware that global health security agenda is a global effort to strengthen world's ability to prevent, detect, and respond to infectious diseases threats. Almost 67 countries have signed into GHSA framework, including the United States, and these countries are committed to support the strategic program which has been there. You have been watching that the world faces a host of dangerous pathogens and potential epidemics. New diseases can emerge without warning and spread quickly. In today's tight connected world, disease can be transported from a remote village to any major city on all continents in as little time as 36 hours. Recently, diseases outbreaks have been demonstrated that disease threat anywhere is disease threat everywhere. People can get on aircrafts and spread diseases internationally with a remarkable speed. Before the corona pandemic, it was estimated that at any point of time, there were around 1 million people on planes in air. Our ability to control the spread of disease is compromised by all this. We have surveillance to spot the diseases at early stages. There is a widespread recognition that health issues and health resources are no longer totally within the control of individual states or countries. If health threats are no longer in the control of individual states or the countries, then you really need to have some sort of global governance to ensure that there is a fair and equitable access to resources to monitor what is going on and to coordinate disease surveillance so as to have an early warning of new diseases. Can we say that what we are seeing at the moment is really a failure of the global health governance? The warning signs have been there for a while. The World Health Organization has been monitoring national preparedness for a number of years now, and the status suggests across the globe more states are unprepared for major disease outbreaks than were well prepared. The disease spread can be deadlier than the world wars. If you see the World War, one of the deadliest conflicts in the human history, 20 million people died. That includes in uniform and civil people. But in 1918, Spanish flu killed 50 million people. The staggering death toll was trailed by economic, political, and social consequences that continue to be felt 100 years later, even now. Today, rapid urbanization and greater connectivity makes us all more vulnerable to infectious disease threats that transit national borders. The growing burden of mental and behavioral health issues and depression now is the largest cause of disability worldwide. Challenges are complex and interrelated and require dynamic solutions. Only comprehensive approach can avoid unnecessary strain on health systems. Dealing with COVID-19, for example, must account for other infectious diseases and chronic non-communicable diseases. Of course, it's no wonder new diseases, infectious diseases like COVID-19, Ebola, Zika get attention, as these are terrifying. But under radar, HIV-related causes still kill 7 lakh people in a year, and malaria takes more than 4 lakh lives. It's vital that malaria control remains health priority, not only to avoid competing with COVID-19 for hospital beds, but also because disease is associated with lower rates of economic growth. Chronic, non-communicable diseases are even bigger killers. They account for 71% of global deaths. And present comorbidities that makes COVID-19 more lethal. COVID-19 has revealed how world is strikingly unprepared for pandemic, how viruses easily spread in the interconnected world, yet going forward with the infectious disease outbreak becoming more common, it is hoped that global health security resources like surveillance, laboratory, workforce, and many more will be strengthened. This is critical for both keeping pace with disease that spread with the severity and rapidity of COVID-19 and being more resilient in face of future global health threats. Thank you, friends. I think Dr. Patni will be able to tell us more about the whether there has been failure in the global health security and how far we have been able to, fight the COVID in a proper manner. I hand it over to Dr. Ashish for further conducting the webinar. Thank you very much.
Thank you, Dr. Ishpal. Now, you all are, very well know our stalwart AHM member, Group Captain Dr. Rajiv Patni. But for those who are not AHM members and have joined from other sources, a brief intro. I will take just 30-40 seconds. Group Captain Dr. Rajiv Patni was commissioned in Indian Air Force in 1989 and has a very distinguished, career in India and abroad. Over 32 years of healthcare experience, including steering in armed forces and including steering the Assam Cancer Care Foundation as head operations and looking after comprehensive cancer care in 19 projects. That is a very big job. He is alumnus of AFMS and AIMS. He has been to so many international appointments also. Presently, Dr. Rajiv Patni is engaged into consultancy with multiple organizations. His interest in global health, healthcare strategy, digital health makes his presence felt in these organizations. And most of you will not know, but I must tell you that he is also a trained pilot. So over to you, Group Captain Dr. Rajiv Patni, to take this session ahead. Your talk time is around 40-45 minutes. You can take it comfortably, sir. Over to you, sir.
Thank you so much, Dr. Ashish Gupta, for that kind introduction. And I must thank the President AHA for making my tasks easier with that exhaustive, comprehensive introduction to the topic. I would also like to thank the Academy of Hospital Administration for inviting me to speak to the esteemed members of the AHA. It's a privilege and an honor for me to speak to the esteemed members. I noticed there are some very senior members in the audience, my teachers, my gurus, my mentors. So before beginning, I would like to bow my head with respect, Sadar Pranam to all my teachers. Is my presentation visible, Dr. Ashish?
Sir, your whole screen is visible, not the presentation. Yes, now presentation is come. You can put in yes, sir. You can change it. I can see whether it's changing or not. Yes, sir. It is okay. You can go ahead.
Right. So, I also extend a warm welcome to all the participants of the webinar today. Just one confirmation, I can't see the participants. Can you hear me?
Yeah.
Right.
Yeah.
Yes. Thank you, sir. Thank you. Right. So pandemics, this is something which has hit us. It has wreaked havoc all across the globe. And within a matter of weeks, the COVID pandemic has brought the world to its knees. It's been 1.5 years now, and we are nowhere near the end of this pandemic at all. Leave aside elimination or eradication of the pandemic, we are not even in any position to say that we have controlled the pandemic in any which way. So what prompted this webinar, this talk, was this policy brief which was published with the Observer Research Foundation, a very prominent think tank of India. For the first time, someone spoke about the geopolitical aspects of the pandemic. Now, let me set the expectations and the envelope of expectations. I will not be speaking about the virus or the vaccines. Enough has been spoken about it, even in the AHA webinars. I will not be speaking about the healthcare infrastructure, the hospital infrastructure. I will not be talking about the epidemiological aspects because everyone and their neighbor knows better about R0 and herd immunity thanks to WhatsApp University than most epidemiologists these days. My discussion will be totally around the global health security infrastructure. So I will give a brief talk about the global impact of the pandemic, and then about the challenges of leading the world in a complex world. Besides the role of the WHO, I will comment on the shifting geopolitical tectonic plates in this milieu, in this environment. A little word about the metrics of preparedness before we talk about global health security and global security, and then we'll conclude. Hopefully, we'll be able to finish this in about 30 to 35 minutes. Now, let's begin with the independent panel. The WHO had come under a lot of fire after the pandemic started, and in September, the World Health Assembly constituted an independent panel to look into the functioning of the WHO and its performance. I was tempted to say to conduct a post-mortem of the pandemic, but obviously I would be wrong there because the pandemic is still alive and kicking. So they did this analysis, not only of WHO, but also of the world's preparation for the pandemic and its response. Their report, after about 8 months of deliberations, was released in May. This panel was co-chaired by Right Honorable Ellen Clark, who was former Prime Minister of New Zealand, and Her Excellency Ellen Sirleaf. She's a Nobel laureate, Nobel Peace Laureate of 2011, and she is former President of Liberia. They had experts from 23 different domains in its panel. So after 8 months of their deliberations, they came to one conclusion, that the pandemic was preventable. So if it was preventable, why are we in such a mess today? Why have we not been able to do something about it despite a lapse of 18 months? This is going to be the crux of my discussion today. Before I talk about how we handled it, let's see what is the threat we are facing. The threat has been encapsulated by NTSI and GHSI, and I would like you to pay attention to this. It says biological risks have the potential to undermine the long-term potential of human civilization. I will repeat, it has the potential to undermine the long-term potential of human civilization. The survival of human civilization in toto. Is this a knowledge which came after the COVID epidemic, after the COVID pandemic? No, this knowledge has been there all along. But somehow it has been in the background, and later in the discussion, I will talk about why it has been in the background. They also talk of threats from accidental or deliberate release of deadly engineered pathogens. This is a discussion which is ongoing right now in the international community about the involvement of Wuhan Institute of Virology. The jury is still out on it, and your guess is as good as mine in this matter. Unfortunately, the biological risks are a blind spot. Why? Because they are not well understood, nor are they prioritized by policymakers. I will be discussing this also, why they are not prioritized by policymakers. So let's talk about the impact of the COVID pandemic. We are all aware of the number of cases and the number of deaths, so I will not talk about it. But the impact of the COVID pandemic has been multidimensional. And this is what we need to understand. A pandemic is not a medical problem. A pandemic is not a public health problem. A pandemic is a security problem because it impacts the survival of the society as we know it. It impacts the survival of the nation. It impacts the economic viability of any country. Now, this graphic that you see here is from the World Economic Forum. They have discussed the impact of the pandemic, not only the public health aspect, They talk about the insurance, impact on hospitality industry, the healthcare, digital business, manufacturing, productivity, aviation industry, finance, sovereign debt. The countries which have borrowed money from, let's say, the IMF or World Bank or from others, sovereign debt default, SDD, is going to be a huge problem because countries do not have anything in their GDPs. Whatever was projected for their growth has all crashed. They are not able to repay their debts. All these are going to have direct and indirect impact on health as well as life as we know it. Now, this kind of graphics and images had become very commonplace in March last year. The map at the bottom that you see shows you the aviation activity over Western Europe 1 year back. That's in March 2019. In March 2020, all these aircraft were out of the air and they were parked in bays. The skies were totally blue and quiet. The kind of graph that you see on the top left corner, this kind of graphs, what I have shown you is only for the aerospace industry, the aviation industry, but this kind of graphs were there for the entire industry, whether it was tourism, hospitality, manufacturing, sales, retail, everything. A sudden precipitous fall in March 2020. This was seen across all sectors. Now let's see what is the total sum of this. IMF estimates that the loss to the global economy is going to be over 28 trillion US dollars by 2025. Just to put it in perspective, India is right now a 3 trillion economy. We aspire to become a 5 trillion economy. 3 trillion is the entire GDP of our country, and 28 trillion is the global loss, which is estimated. This is going to get multiplied further. Now, since we are all doctors and hospital and healthcare administrators, let's look at one component of health, which is life expectancy at birth. What was the impact of COVID on the life expectancy at birth? The data I have here is from USA because this is most complete data that I could get. One study after 6 months of the epidemic, that is from January to June 2020, just the first 6 months of the epidemic, estimated that the life expectancy of American citizens will fall by 1 whole year. What does 1 year mean? This graph here shows in steps of 1 year how much time it takes to increase the life expectancy by 1 year. So for example, from 71 to 72, it took about 5 years for it to grow from 71 to 72 years. Now let's see what happened in the current situation. In 2020, it fell down from 78.8 years to 77.8 years, roughly the level of 2008 life expectancy. In the first 6 months of the pandemic, USA lost the dividend of 12 full years in just the first 6 months of the pandemic. There are estimates that North America and Europe will lose anything from 3 to 9 years in their life expectancy. 3 to 9 years. This graph here shows what will happen if they lose 8 years. If US has a life expectancy loss of 8 years at birth, it will fall down to 1970 levels. That is, within a year, it would have slid by 50 years of progress. I hope we can understand the dimensions, the magnitude, of the impact that this pandemic has had on us. The further impact, there will be long-term lingering health effects of COVID. Long COVID is already a known entity. It will also impact delivery of healthcare to other patients. We are already seeing tuberculosis program is impacted, cancer treatment is impacted, NCD programs have been impacted, even the immunization program, the regular immunization program has been impacted. The maternal and child health programs have been impacted. COVID per se will also, it causes aggravation of other conditions. And something which will come in the future, we have not yet seen this, is the health effects of the economic turndown. People have lost their jobs. People have been caught up in containment zones. All this is going to have a cumulative health effect on populations. We have not yet talked about the mental health impact. There is an epidemic of mental health illness which is going on along with this pandemic in different populations across the world. We should also remember that this is going to cause demographic changes in populations. To just give you an example, 8 out of 10 COVID deaths in the US were in the population which was above 65 years. In Europe, 9 out of 10 deaths were in the population of above 60 years. So 9 out of 10 was above 60 years, 8 out of 10 above 65 years in USA. Now let's put this in perspective. At the end of the Spanish flu, which President AHA mentioned in his opening remarks, the life expectancy in Europe was 54.8 years. Over 100 years, they have toiled and the life expectancy reached 78.8 years. The bulk of the population that has been added in this demographic change is the population above 55 years. So life expectancy in 1920 used to be 55 years, 54.8 to be precise. So the bulk of the gains have been in the population above 55 years. You see how the COVID pandemic has wiped away, has sliced away at the gains of 100 years. All these gains thanks to antibiotics, antivirals, living conditions, improvement in economy, education, hygiene, etc. Because life expectancy is not only related to mortality, it is related to so many other, it's a multifactorial index. What we gained over 100 years has been wiped away by this pandemic. And not to forget, each death leaves behind an average of 9 bereaved family members. So how did this outbreak become a pandemic? Let's look at the role of WHO and other multinational agencies. The role of WHO is the custodian of the international health regulations. This is derived from the International Sanitary Conferences of Europe. These were subsumed by WHO under Article 21 and 22. They give them powers to make regulations. And in 1951, these conferences and conventions were converted to international sanitary regulations, which in 1995 were renamed as International Health Regulations. Just to put this in perspective again, what was happening from 1851 onwards was Europe's attempts to prevent diseases from its colonies and New World from reaching into Europe. So the focus was primarily on cholera, plague, and yellow fever. This continued intermittently, other diseases were added, but in 1995, it was once again back to cholera, plague, and yellow fever. This became a problem in 2003 when the SARS outbreak took place, because SARS was not listed in the IHRs and WHO found its hands tied on how to act. So 2005, a revision of the IHRs took place. Now, I must remind, IHRs are legally binding. There are only two of WHO's regulations which are legally binding, which is the tobacco control and the second is the international health regulations. In the revised IHRs under Annex 2, SARS and influenza were included. It was realized that respiratory pathogens have the biggest risk of pandemic. And under Article 6, the nations are supposed to notify to WHO of any public health emergency within 24 hours. Let's see what happened in this pandemic. On 30th December, Wuhan Municipal Commission issued an urgent notice about a cluster of cases of PUO. PUO here stands for pneumonia of unknown origin. On 31st December, this was picked up by WHO's ProMed. ProMed is a program which is being run by them for monitoring emergency diseases. ProMed is program for monitoring emergency diseases. They asked China for information. China, we all know, they have their own merits, but transparency is not one of their merits. China took its own sweet time giving the information. WHO in turn took its own sweet time for calling its emergency committee. It took them 6 weeks to call its emergency committee. The emergency committee sat for the first time on 22nd of January. They could not come to any conclusion. Finally, on 30th of January, they declared a public health emergency of international concern. PHEIC is the highest level of emergency that WHO declares. By this time, there were 1 lakh cases over the world and more than 2,000 deaths had already taken place in different countries. Surprisingly, after this, there was a lull. The IPPPR has called it the lost month. And finally, on 11th of March, WHO characterized the outbreak as a pandemic. We don't say they declared a pandemic, they characterized it as a pandemic. By this time, so many cases had taken place and nearly 20,000 deaths had taken place. 19,400 deaths had taken place all across the world. And COVID had reached all the continents except Antarctica. It finally reached Antarctica in December 2020. So by the time they declared a pandemic, it had already reached all the continents. I will be talking a little more about the lost month later. But let's see, could they have done something better? I will be giving you 3 case studies here. The first case study relates to Blue Dot. Blue Dot is an AI company based out of Canada. It has only 44 employees. And Blue Dot had on 31st of December already issued a health alert to the world. Mind you, WHO was still asking for information. Blue Dot had issued a health alert about pneumonia of unknown origin originating from Wuhan, and they had informed the world. Before I discovered Blue Dot, I never even knew that such companies exist and there could be careers in such companies. The younger listeners today may look at this as a career option. Who wants their information? Airlines, multinational companies. They've got production across the continent. They've got supply chains. They have to optimize all these things. They buy this information from them. Now, Blue Dot uses AI, and you've had a session on AI earlier, and we can discuss this later during question answers. They say we find the needles in the haystack and present them to our team for further investigation and analysis. Blue Dot even went on to predict which will be the cities which will be immediately affected by the Wuhan virus. The second case study I would like to bring to your notice is the Ebola outbreak of 2014. This was the first time the United Nations Security Council issued a statement on a public health problem, and they said this can be a threat to international security and peace. Let me put it once again. United Nations Security Council is saying it can be this disease can be a threat to international security and peace. How many cases were there? The bulk of the cases were in West Africa. Outside of Africa, there were only 36 cases. 36 cases, that's all. And UNSC assembled its team and issued this statement on 15th October 2014. The final case study I want to bring to your notice is the SARS outbreak of 2003. As I mentioned earlier, the IHR did not have SARS in it. But Gro Brundtland, the Director General at that time, she decided that the disease, the outbreak, is causing deaths and it is a threat to human rights. She took suo motu notice of it, even though legally she was not empowered to do so. WHO again kept asking for information. China kept refusing information. On 2nd of April 2003, she announced restrictions on travel to and from China. This is a very, very stringent sanction which she announced. She publicly named and shamed China. On 4th of April, just 2 days later, China came forward with all the required information. 3 weeks later, they fired their health minister and everything. So what changed this time around? The DG was begging for information. The DG was going around saying China is very good. They were praising China for its transparency and support and everything. What has changed? The change between Ebola and COVID of 2020 is Ebola was in Africa, COVID is in China, and China of 2020 is not the same China that was there in 2023. Geopolitical tectonic plates have shifted, and what we are seeing is the global struggle for power. So, do we still need WHO? Oh yes, definitely. But we need strong-willed and decisive. WHO is the only legitimate broker with some credibility and presence on the ground. But let's see what was happening in the rest of the multilateral organizations. G7, there was a fight amongst the members on what? The fight was on whether to name the origin of the virus or not. G20, once again, there was political acrimony. The Security Council was paralyzed. China was in presidency. At each forum, there were fights between the US and China. But I want you to have a look at this. This is the G7. China is not even there in the G7. It has only European countries, Japan, Canada, and USA. And these European countries themselves opposed it, and they said, no, we can't name the origin of the virus from Wuhan, from China. We cannot say the disease has originated in China. This is the level of influence that even though China was not present, US could not issue a statement in G7 on the COVID pandemic. It's a very complex world. We have to understand the geopolitical realities. Now, we have seen the impact. Let's see how you measure the global health security. The Global Health Security Index came out in 2019. They gave ranking to all the 195 countries which are member of WHO and so signatories of the IHRs. And first in the rank, no surprise there, was USA. Second in rank was UK. Most of the African countries were very low down on the ranking. Let's see what is the ground reality. This is the number of deaths in US, which is ranked 1, number of deaths in UK, deaths per million people. So it's the per capita kind of data. And these are the two countries which are 194 and 195 on their list. What it shows is the world is unable to measure its preparedness, its response mechanisms. So we have seen how the healthcare infrastructure is compromised. What we see here is that the world is even unable to measure what is going to happen, what is the preparedness. Interestingly, 194 and 195, these Somalia and Equatorial Guinea. Interestingly, 189 and 191, have a look at this, Kiribati and Marshall Islands. They are so low on the list. As of last week, both these countries had 0 cases. So this is the level of the metrics which are being employed by the global health community. We need better methods of assessing preparedness. I have shown you Blue Dot as one of the methods in this. So global health security, everything which is emerging now depends on this famous triangle: agent, host, and environment. And most emerging diseases are zoonoses. Zoonotic spillover means these are diseases which come from animals to humans. And when there is a geographic spillover of these diseases, we have epidemics and pandemics. What is the magnitude of the emerging diseases and re-emerging diseases in the world? If you open a website called healthmap.org, all these dots that you see are showing the outbreaks in progress. These are 2,655 of the highest rated outbreaks in the last month. Most of these dots are COVID, but if you scroll over these dots, you will find monkeypox, rickettsia, even antimicrobial resistance, etc. are there in it. There's a plethora of diseases which is there across the world. Various outbreaks are there. Any of these outbreaks can become an epidemic or a pandemic at a later date. And now, one more thing that we need to understand is viruses don't understand borders. This is the state of the world and the distribution of the various variants of the COVID virus, the alpha, beta, gamma, and delta. You see how the entire world, almost the entire world, has been affected by the variants in a very short time. And this is despite all those travel restrictions which were in place. So we need to understand that the virus moves faster than the surveillance and response system. And we need to strengthen the GHS infrastructure, empower and strengthen the WHO. There is a call for having a GHS coordinator at the United Nations Secretary General's office, and there's a call for adequate financing to support this. But what we need to do at all levels is to prioritize this to the level of national and global security. Nothing brings the nation together like a war. And we have to elevate the responsibility to the heads of nation. Because as I've shown earlier, a pandemic is multidimensional and it is not a medical responsibility. It's not a public health responsibility. You order a containment somewhere, you order a lockdown somewhere, you see the amount of problems that the administration has to go through. And the world has to understand that this is a shared risk. So it has to be a shared responsibility. But the world has been behaving in a very shameless manner on this count. So why is biological risk not seen in the terms of global security? Because after the Cold War, after the Second World War, actually, the physical fearsomeness of nuclear blasts has become primary. Images, movies, everything has been carrying these images, a post-apocalyptic world, gray skies, damaged buildings, no population. But what people don't understand is the effect of a nuclear blast is limited in its geography. However awesome the blast may look, it is limited in its geography. The only time the perspective of national and global security changed was after 9/11 terrorist attacks on New York. So terrorism became another focal point of security. Hopefully now, after the impact of this COVID across the world will start taking the virus more seriously. The COVID pandemic has shown that wealth cannot protect. The richest of the countries have suffered the most. It spreads undetected. And the worst is, if a virus is used for warfare, biological warfare, it is a very low-cost warfare. And it comes with total deniability, just like what we are seeing. China says, no, it has not come from my virology lab. Although it's in the same city, it has come from the seafood market. A very well-calculated narrative and videos were floated around bat eating and other such things. But we cannot forget that biological risks are a threat to the viability of human civilization. The picture you see, I have purposely put a picture of the Ebola virus here because our perception of virus has become a globular thing with spikes on it. We must understand viruses come in different shapes and sizes. So will we be better prepared the next time? I have 3 quick slides before I conclude. This shows the map of the world, the number of vaccine doses per capita which have been given. What is amazing of this pandemic is how fast the vaccines were developed. Although the development of vaccine depended on decades of research, but we were able to convert that decades of research into viable vaccines within a year, which is fantastic. But look at this. Look at the dark areas on the map. These are the rich countries. They have gone in for something called vaccine nationalism, hoarding vaccines. In fact, latest news is that they are dumping vaccines because they have expired on shelf. Contrast that with these poor countries. In many countries, 0.1 to 1% of the population has been vaccinated. They have not even received vaccines. And that way, India is very lucky. We have domestic production of vaccines. However, we have a huge population to be covered. So naturally, we are not as dark blue as the others. Vaccine nationalism is ethically unacceptable, but it is politically inescapable. I will talk about this in the next case study. We look at this country which has been marked here, Mongolia. When the disease first came to notice, Mongolia did not wait for WHO to declare a public health emergency or a pandemic. In January itself, they closed their borders. They started screening of all incoming passengers. Masking was made mandatory. Schools were closed and schools were shifted to the national TV. Unlike India, where we went on the online mode, they shifted the schools to national TV. Economy suffered. People were not very happy about it. But they managed to keep the graph low throughout the year. Till January 2021, managed to keep the graph so low. They had cases in one single or double digits. But then something strange happened. On January 23rd, their prime minister was forced to resign. There was an uprising against him, and as is common in democracies, this uprising was sparked by the political opposition. So the prime minister was forced to resign, and you can see how the graph went steeply thereafter. Within 3 months, we had so many cases over there. What was a model of management suddenly was lost. Is this all gray and dark? I wouldn't say no. Mongolia turned out to be a responsible democracy. In June 2021, the prime minister who was deposed, he came back as the president of the country. And now they are once again controlling it. So politically, it is very difficult to impose sanctions, economic lockdowns, because it's a matter of livelihood. But when you have an epidemic, there is going to be some loss of liberty. We have to sacrifice our liberty. We have to sacrifice economic gains as well. The third case study I'm giving you is from India. The gray line at the bottom is the first wave of the COVID, and the orange line that you see above it is the second wave. This tells you so many stories. The COVID first wave went very slowly. We did not even know what COVID was, but we managed to control it very well. But look what happened in the second wave. Just about 6 months after we had controlled the first wave, people threw all caution to the wind. There were gatherings, there were crowds, there were weddings. I'm guilty of participating in a wedding during this period, just before this period. People were partying like there was no tomorrow, and see how steep the curve of the second wave was. The steepness is partly because of the transmissibility of the Delta variant, but also because of the irresponsible behavior of people. So here we have a disease which has taken away, has impacted our life, has taken away our liberty, has impacted our livelihoods. It has affected our normal way of living and is likely to be a threat to the viability of humanity. Yet, since the past, the bacterial diseases have been in the background. What you see in the foreground is US exploding a nuclear bomb in the Bikini Atoll. That's where the US and UK used to conduct their nuclear tests. They conducted more than 60 nuclear tests over there. Why I have brought it here is for two reasons. One is the name Bikini came from the Bikini Atoll because of the attention the media was giving it at that time. And secondly, they exploded 60 bombs over there, but where was the global impact of it? Nowhere, except for scaring their enemies. There was no impact on the global economy. Now, the IPPR has given a very damning verdict on WHO. It says WHO is not fit for a crisis of the present nature. It goes on to say that the executive board of WHO is a forum for reading statements rather than for strategic discussions and proper governance. Normally, in international panels, we speak in a very diplomatic manner. But even under the diplomatic niceties, they could not stay away from making this statement. This is the statement from the International Federation of Red Cross, that building back better is not good enough. We really have to build very differently. These are a few of the terms which came into our common lexicon. This word cloud has been formed from the article that I showed you in the beginning. What the frequency of the various words there has been brought out here. I hope I have been able to sensitize the audience about the magnitude of the problem, the geopolitical issues which are there, and how it's not going to be an easy journey. People ask me, when will this pandemic end? Again, there are no easy answers. We are far from eradicating it, let alone eliminating it. We are not even close to controlling it. It's just a matter of another variant popping in, which is resistant to the vaccines, and we will be back to square one, and the cycle will begin again. With this, I have finished. Thank you very much, AHA, for giving me this opportunity, and thank you very much for your patient hearing.
Thank you, Dr. Patni. There are a few questions and observations. One is from Colonel Surekha Kashyap. She says that is the data about deaths per million for COVID-19 reliable from African and Asian countries, or there is a gross underreporting and non-standardized protocol for reporting?
Right. It's a very good question, and this question is raised against India also. So let me put things in perspective. WHO came out with a report earlier this year, and they said that the data from, I will come to Africa in a minute, the data from America and Europe had anything from 40 to 60% undercounting. Undercounting. It is not under-reporting, it is undercounting. The data infrastructure was definitely impacted, and so data collection, cleaning of the data, even the definition of a COVID death is not very clear. WHO has been changing that definition over the period of time. So coming to Africa, Africa was one of the countries, Africa was the continent which even before WHO declared a pandemic, they had called a meeting of all the health ministers of the different 54 countries in Africa, and there is something called the African CDC, just like the US CDC and the European CDC, there is the African CDC. They called for a meeting and they alerted their people to come up and be ready for any cases which are detected. Thanks to the GHSA, Global Health Security Agenda, which the President mentioned in the opening remarks, they have had very good training, and thanks to the Ebola outbreak and other outbreaks which keep happening in Africa. Africa is the mother of all emerging diseases, if we don't count China. So they are trained, their track and trace mechanisms have been very well fine-tuned, and they have developed a laboratory infrastructure which rivals the best in the world. So collection of samples, taking them to the sample, testing of the sample, reporting it, the data collection is very good. However, there will always be doubts about the number of deaths. But as I have put it in perspective, the number of deaths even in USA and Europe are not reliable. We can't go by the data which is available, but we must give credit where it is due. Africa has handled its pandemic very well. I hope that answers the question.
Okay. Chiranjeev has got a question that India considered the COVID management strategies more from a political sensitive approach than a technically correct approach. What do you think about this?
Thank you. Thank you very much for this question. Once again, this is a question which is there in everyone's mind. Let me take you to USA. They went about the whole thing in a politically sensitive manner. There were going to be elections. USA does not like any kind of restrictions. They even said that masks are not required. People were gathering around. You have to handle pandemic in a very politically sensitive manner. And I am going out on a leg and I will say this thing. India handled the pandemic very well. Whatever other people may say, there are emotional components. Any family which has been impacted will definitely have something to be very upset about. Because a death is a death, whether it is from COVID or a heart attack or from malaria, a death is a death. So people have been very seriously impacted. But I must give credit where it is due. I have gone through the data, the technical reports, and I have compared it with international data and international reports. I'm quite convinced we did very well, except when after the first wave, we decided to give up control from the center and states were asking for control. We said, okay, health is a state the subject anyway, so you take over control. And the states then failed to implement the recommendations. The center kept giving recommendations. I am aware the Prime Minister used to hold meetings with the chief ministers of the different states. Some states chose not to even participate in those meetings. It's a fact. So second wave hit us very bad. Delta variant was one of the reasons. People's behavior was second. And third was the reluctance of the states to take action. I hope I've answered your question.
Okay. Another question from Ajay Gongli. What could be the recommended way to empower WHO to rise above the regional pressures? Could there be the change in the method of officials being appointed at WHO?
That's a very, very pertinent question. Thank you, Dr. Ganguly. WHO is an international body, and the Director General is appointed through an election amongst the members, and it is through consensus. Politicization of the multicultural bodies is a fact which we cannot deny. Right now, out of 17 of the UN bodies, 4 are led directly by China. China is the only country which is leading more than one of these bodies. So FAO, the International Telecommunication Unit, ITU, UN, UNIDO, it is leading 4 of these. Politicization is something which has to be accepted, and we have to work within those parameters. However, what has been suggested, what has been recommended by the independent panel is that the WHO DG should be selected for a single term of 5 to 7 years. WHO DG should be directly responsible to the UN Secretary General. This has been recommended, and I'm sure it will now be accepted because the whole world has seen the impact of letting an outbreak run loose in the world. They have also recommended that a corpus of $50 to $100 billion should be prepared so that this can be disbursed at a short notice whenever required. I must also bring in here about the budget and the funding and financing of WHO. Many people are not aware that only 17%, 16.55% of the budget of WHO comes from the member states. More than 80% of the budget comes from something called VC, voluntary contributions. This comes from the NGOs, organizations like Wellcome Trust, Gates Foundation, Clinton Foundation, Global Fund. These are the biggest funders. So since they are the biggest donors of WHO, they demand their pound of flesh, and they demand that their agenda should be met. So the financing also needs to be changed so that WHO has ability to exercise some control.
Dr. Siddharth Sarpathy, please come in for your comments, sir.
Yes.
Rajiv, it was an excellent presentation, but I have a couple of pointers to you.
Right, sir?
You see, what I feel is that this whole thing that you explained can also be seen through the lens of ethics and morality.
Absolutely, sir.
Now, you see, when we very recently, what we found was some of the amateurs, they tried to search and find out what could have been the origins. You left that question unanswered by saying that there could be as many theories as and the number of listeners for your presentation. But you see, I think if we see it through the lens of ethics and morality, even the United States is equally responsible. You see, we are never addressing the issue of conflict of interest. Now that the same gain of function research, which for 15 years or 10, 12 years has been doing, research in the labs, now that could be one of the biggest reasons why this whole thing has happened. And then no one is questioning. We are questioning WHO. We are questioning China. We must question the truth as well. You see, I am fond of a adage now, showing truth to power. This is a very common thing which is now being discussed even in political and academic circles. Now the point is that even people at the top have made mistakes. They have hidden those mistakes. They have led us on a wild goose chase, and all that in the context of the problems that we have. Under-reporting, underfunded healthcare system. So probably, that area, health security can not only be, government organization or intergovernmental organizations. Health security should start right at the top. But unfortunately, it became a political issue in US also. And it is likely to become a political issue in all countries which are likely to have elections within the, shadow of this pandemic. So, that's my take on this.
Thank you very much for your inputs, sir. Gain of function research is a fact of life, and the group of amateurs you were talking about, the seeker, I purposely did not bring it in so that we don't get into conspiracy theories and the focus remains on the geopolitical aspects of it. Definitely, there is, if I were to speak about the origins, I can have a 1-hour talk only on the origins and how things are pointing in certain direction. Gain of function research is a very, very controversial thing, and that is why it has been shifted out of the USA, because there was local objection to it. It was shifted out of there, and these people are hand in glove with their hand in glove.
It was shifted out only after 2012.
Exactly, sir.
Now, 5 to 7 years before 2012, it was very much happening in USA also. And we don't know the intent. The intent could have been something like this also. Now, you see, in the court of law, we have to look at who is gaining. The same Bill and Melinda Gates Foundation, which are, main sponsor of the global health security, creating that index and all those things, everything is wrapped in conflict of interest. They are the ones who are funding it. They are the ones who are saying that we must be aware of security. Somewhere, things don't fit in. That is my take on it.
I fully agree with you with that.
Google
Thank you,
itself
Dr.
is
Siddharth.
involved. Can you imagine Google itself? And I will not say that it is just bare conspiracy. There is now enough evidence in the open source platforms which say that things are actually pointing towards a very sinister design. So somewhere I think, the health security of a globe should also think of that, because there are none of mad people, let me tell you, in this world. Some of them are leaders as well. I will leave it at that.
Okay.
So, yeah, please.
Dr. Sirikar, you want to comment, sir?
Basically, very well presented, Group Captain Patni. And I think you touched a topic which most of the healthcare workers who are on ground working are not thinking of it much. And you made everyone wise. I must compliment you, and very well presented. Thank you so much.
Thank you so much. Thank you very
Right,
much.
sir. So I think, Dr. Yashpal, you want to comment something here at this stage? Sir, unmute yourself.
Yeah. I just want to compliment Dr. Patni that he has given a very good talk. It was excellent, very bold talk, and I think we required more time. Dr. Siddharth was giving very good inputs and very bold inputs. In fact, everybody is talking about it, but still we
No,
need
it is
to
being
talk
hushed.
more.
It is being hushed.
Yes,
It is being hushed
it is
because
set
of the
up.
powers that be.
We need
See,
to be more.
either we take cognizance or we say that no, everything is fine.
Yeah.
You see, science and history, two subjects. Science and history will never obey power. Science will least obey power. You see, you can't change the laws of Newton or the laws of gravity because the political powers that are there say that no, it is not like that. You see, science has to somewhere, confront power also. So, well, that's a topic for another day.
Yes.
We can't discuss that
You
here.
can speak on it. We'll welcome that, and obviously one has to be transparent. That is really appreciable. I really compliment you, Dr. Patni, for coming here and giving a very nice talk. Thank you.
Okay, thank you. Dr. Patni, you have really shaken the soul out of me. Your few couplets are, shaking me, echoing in my head. 28 trillion US dollar loss 2025. Life expectancy falling by 1 year, taking us maybe to 50 years back in the whole pandemic. Second. Third, which you say each death leads to bereavement of 9 members. They were very, very, sad state of affairs. And to top it all, you say virus moves faster than our actions, our thought. Or virus is faster, and pandemic was preventable. So over to Dr. Professor Anil Gomes for conclusion of the session and the vote of thanks. Over to you, Professor, sir.
Thank you, Dr. Ashish, and thank you for this present task of vote of thanks. Dr. Rajiv Patni has really shared some of the very useful information, more of I would look at it as an audit of what has happened. For me, audit is more important. It gives us, where we have gone wrong. Maybe we can avoid this in future. It may not be preventable, it may recur, but at least we can be better prepared. Thank you, Dr. Rajiv, for your sharing this valuable information with all the today's participants. We are grateful to you on behalf of the Academy, BOE President. We are grateful to you for sharing your time and knowledge. And we remain grateful to you. Sir, are we presenting the certificate today?
No, we are not.
Okay, we will be sending you a certificate
Yes.
we will be sending a certificate of appreciation for sharing your knowledge with us. And thank you all the participants joining us today for this very useful presentation on pandemic. I don't want to discuss any further because Dr. Patni has shared so much of valuable information. I don't have anything further to add. He has made our task easier. I wish this YouTube recording will be seen by many more MHA graduate students so that we can we can do it better next time. Thank you very much. Thank you, everybody. Thank you. Have a nice weekend.
Have a nice day.
Thank you, everyone.
Thank you.
Thank you.
The session is declared closed. Thank you so much.
Thank you.